Good morning, everyone. As we all know, the entire world is greatly affected by this global pandemic.
Many countries are struggling to keep cases low and to avoid as many deaths as possible due to this virus.
However, there are quite a few countries who did outstanding in fighting this pandemic. So, let's take a look at three of them and how they fared against the virus. Take it away, Maxine.
The country of New Zealand, being one of the first countries in the world to be completely free from COVID-19, has obviously done something that no other country has done in combating this virus. The first cases of COVID-19 in New Zealand were discovered on February 26, 2020. And just a month after that, with only 100 confirmed cases, the country went into lockdown. And on June 9, the country declared being COVID-19 free and reopened after having no new cases for 18 days, which means that the first breakout of the virus in their country has only lasted for 104 days. So how exactly did they do this? The most important thing that they did was implementing an alert level 4 countrywide lockdown after just a month after the first case. This means travel restrictions are in place to avoid cases going in and out of the country. This also means that people are in their houses most of the time. Aside from a countrywide lockdown, community-based safety measures were also in place. The country has also did its best to get as many citizens vaccinated, which is evident in the percentage of their population who are already vaccinated, which stands at 73.7% as of this moment. As of today, New Zealand has only had a total of 12,986 cases and 47 deaths, which is only a fraction compared to other countries like the United Kingdom, which has had 10.8 million cases and about 146,000 deaths.
Wow! Thank you for that amazing report, Maxine. New Zealand conquered COVID-19 by following protocols immediately and implementing very strict rules. Now let us move on to Nathan to know how other countries with big success in combating the pandemic, which is Taiwan. Nathan, take it away.
Taiwan has been widely applauded for its management of the pandemic. Just 11 people have died from COVID-19 in Taiwan since the pandemic began, despite being considered high risk at the start due to its proximity to China. There was a new study in the Journal of the American Medical Association where they examined further why Taiwan did so well in conquering COVID-19. They were examined using the two types of COVID-19 policy. Case-based, which means keeping an eye on the number of infected people, also including the people who were in close contact with the infected in the last 14 days. And the second policy is population-based. These are the face mask policies, personal hygiene, and social distancing. The effects of these policies were quantified by estimating the effective reproduction number, or R number. The R number is a way of rating an infectious disease's ability to spread. They then used the estimated equivalent number in China, which is the R number of 2.5 to compare to Taiwan. The study found that the case-based policies alone could lower the R number from 2.5 to just 1.53. And at the end, quarantine contributed the most to lowering the R number.
Thank you for that nice piece of information, Nathan. So Taiwan conquered COVID-19 by using the two types of COVID-19 policies. Now let us fly to Hong Kong to find out how they conquered COVID-19. Take it away, Lawrence.
Hong Kong, located in the southern China and shares a border with mainland China. It has a population of more than 7.45 million and is a regional travel hub with the 8th busiest airport in the world and with more than 70 million travelers passing through it each year. This, together with its proximity to mainland, make Hong Kong vulnerable and to being severely affected by coronavirus disease. But study authors assume that influenza and COVID-19 spread similarly, so they used pooled data to track potential changes in transmission among those who have been practicing in Hong Kong's public health measures. They collected data about influenza like illness from about 60 general outpatient clinics as well as age and sex of patients. The three studies periods included January 20 to 23, February 11 to 14, March 10 to 13. The investigators included 1,008 participants in the study for the January period, 1,000 in the February period, 1,005 in the March period. Participants were called using randomly generated phone number by computer system and were surveyed about their thoughts on measure of risk perception attitudes towards COVID-19. Behaviors taken against contracting the virus like hygiene, face mask, social distancing. As of the end of March, Hong Kong had 715 confirmed cases, COVID-19 cases, including 386 imported cases, 142 cases that did not be linked to any other case, and 170 cases linked to other known cases. Of the total number, 94 cases were asymptomatic. The investigators reported by quickly implementing public health measures, Hong Kong has demonstrated that COVID-19 transmission can be effectively contained without resorting to the highly disruptive complete lockdown adopted by China. As the USA and Western European countries, Benjamin Cowling, PhD professor at the University of Hong Kong, said in the press release the investigator also learned that 85% of those surveyed reported avoiding crowded places, with almost 99% reported wearing face masks when leaving home by third survey period. During the SARS outbreak in 2003, the study also added reported face mask use was around 79% in similar surveys and only about 10% during H1N1 flu outbreak of 2009. Almost all of those surveyed who were parents agreed or strongly agreed that school closures were necessary as a measure of controlling COVID-19, the study authors noted.
Amazing how these countries were able to combat the pandemic, huh?
That's exactly what I thought. Other countries could really learn a thing or two from these three countries.
This has been
Jason Baraba,
Lawrence Magada, and thank you for listening.